The vaccine from AstraZeneca is the third from a major drug maker to show promising results. Pfizer and Moderna have previously reported about 90% effectiveness. We want to know how the AstraZeneca vaccine compares to those other two options.
Let's start with Pfizer, which is said to be 95% effective. That vaccine has already been submitted for FDA emergency use authorization and could earn that distinction by mid-December. The main drawback is that it must be stored at temperatures as low as -70 degrees Celsius. Moving on to Moderna now, which is 94.5% effective. An emergency use authorization request expected in the coming weeks. It does not have the same cold temperature requirements, able to be stored instead at temperatures between 36 and 46 degrees Fahrenheit. And the new AstraZeneca vaccine is said to be 70% effective on average, but was up to 90% effective in certain trials. AstraZeneca says it expects to have 200 million doses ready by the end of the year. That vaccine can also survive in 36 to 46 degree temperatures. It is also expected to be the cheapest of the three options.
Joining us now on NewsNation to discuss the new AstraZeneca vaccine and all of the vaccines in general is Dr. Jeffrey Pothof, Chief Quality Officer at University of Wisconsin Health. Doctor, thank you for talking to us tonight. We appreciate you carving out some time.
Thanks for having me.
Let's start with these vaccines. What can you tell us about the makeup of these vaccines and what's in them to make them different?
Yeah, the Moderna vaccine and the Pfizer vaccine are similar in that they use messenger RNA. So they use basically the script to create what we know is the spike protein of COVID-19. So they synthesize that protein so that our bodies can make an immune response to it. The AstraZeneca one is a little bit different, where it uses a common cold virus that's inactive, doesn't make us sick, to also express that spike protein so that our immune system can react to it. So all these vaccines are really targeting that spike protein, which is important because that's what the virus uses to infect our cells.
As far as the AstraZeneca vaccine, we know it may be easier to distribute because it doesn't have to be kept as cold, and also it may be cheaper. So when you look globally at the pandemic, do you think that vaccine will be used in other countries before we would be seeing it here in the U.S.?
Yeah, I think the real benefit of that AstraZeneca vaccine is, one, logistically, it's much easier. There are places in the world where a -70 freezer is not that easy to come by. So that's a big plus for the AstraZeneca vaccine. The other thing is it's orders of magnitude cheaper. In a country like the United States, Great Britain, maybe that doesn't matter. But in some countries, that's the difference between having widespread vaccination and not having a vaccination program. So two really important things for the AstraZeneca vaccine that aren't as prevalent in the other two vaccines.
And doctor, we know frontline workers, those with compromised immune systems, will be first in line to get the vaccines once they're available. But what is your best guess for when the general public will be able to get these vaccines?
I feel pretty good that by April, May, we're going to have very widespread vaccination programs. There'll be a little bit of regional variation, but I think, by late spring, certainly by, early summer, there should really be no reason why someone who wants a COVID vaccine can't get one.
Let's talk a little bit about durability. I know that it's been brought up from time to time, and it is hard because this process has moved so fast to understand really how effective and for how long these vaccines will work. But if this had been a normal vaccine trial in the past, where it's given a lot more time, would we better know durability?
We would. So one of the reasons that vaccines can take so long to come to market is they would have completed the durability component of the trial before releasing it. So you would know the vaccine lasts 3 years, 4 years. In this case, the pandemic is so out of control. There are so many people dying. Even if the vaccine only lasts 1 year, it would definitely be worth it for everyone to get it to put an end to the pandemic. And as we have people enrolled in these studies, we will learn how long these vaccines last. So we'll know if there needs to be a redose. But the urgency is so great to just put an end to this pandemic that even without the answer to that question, it does make sense to start distributing these now, as long as we know that they're safe and effective.
What would be considered good in terms of durability?
Well, best case scenario would be lifelong, but even if we got 10 years out of it, think of tetanus, a vaccine that we get once every 10 years. Not too many people are complaining about that. For something that's so dangerous like COVID-19, even if you needed to get an annual COVID shot with your influenza vaccine, I'm not sure that's such a big deal.
And finally, doctor, I know that a lot of people are curious about when kids would be able to get the vaccine. What is your estimate on that, and would it be the same vaccines that are being developed now?
I suspect it'll be the same vaccines. We'll have to have additional information in those young populations. I suspect the companies would probably have that information by February, March. And by April and May, you may start seeing, children get that. A little bit later for infants, that requires another round of kind of safety evaluations. But I would say, sometime late spring, probably looking at vaccine available for children too.
Very good. Dr. Jeffrey Pothof at the University of Wisconsin School of Medicine, we appreciate your time and all your insight tonight. Thank you very much.
Anytime.